is what do you think Tommy Douglas would do today in terms of trying to improve healthcare for Canadians? Looking at the backdrop, maybe I know there's quite a few challenges, but let's maybe specifically focus on primary care here. The idea that there's so many physicians, it's basically long wait times for primary care physicians. What do you think his approach would be in the current, current situation?
Well, I think he would insist that where there are groups of people not being served, that uh, the government step in directly and ensure that there are the clinics and the personnel available to provide that primary care. That you don't simply wait for the market to fill that vacuum through privately practicing physicians. That you rely on nurse practitioners or registered nurses in community health centers, or that you, in fact, arrange for those, you know, groups, community-based organizations, etc., to set up those clinics and be paid through the public purse to provide primary care. I think he would have moved very aggressively on that. He believed very much in what was called the community clinic in Saskatchewan, where doctors came together to work with social workers, nurses, and other health professionals to provide comprehensive primary care. And he himself supported that concept, spoke about it extensively in the 1960s and 1970s. And so he would very much support that kind of development. Um, he would also probably insist that every individual and every family have and be registered to a primary care practice to ensure complete coverage, and that they would be up to the practices to ensure that it would be after hours coverage and on weekends, so that people would not have to go to an emergency department room, or uh, only in cases where they needed extremely serious urgent care, but they would be looked after in terms of these primary care clinics. A lot of the reasons that people are going is because they cannot get care after hours. They can't even get an appointment at their primary care clinic that within a day or two after they call in to say they've got a problem, even during office hours. And those are the issues that he would want to see addressed, I'm sure.
That's incredibly interesting because I think I forgot who I spoke to about this. I think it was actually and another previous guest, Tyler Meredith. If you, I'll put that in the show notes. He was an economic advisor to the current Liberal government in terms of the economic policies and so forth. And he had mentioned that Canada, at least from a healthcare perspective, had moved towards a very hospital centric type of model. So actually, from Tommy Douglas's perspective, despite him ushering in the Hospital Act, when one of his first things that he did, he actually didn't necessarily believe that all care should be delivered in the hospital. He actually more believed in these community clinics where care is actually delivered in the community setting.
Well, community setting and in home. He very much believed in home-based nursing care, what we would today just call home care. Uh, and he would also, have argued that there was a big role for prevention, and that prevention should be built into primary care in a much more fundamental way.
Yeah, that's something that's incredibly interesting because I think many people have this take that in some cases our system is it's named incorrectly, that it's not really healthcare that we deliver, it's really sick care that we deliver. It's when someone's sick, then you treat them, right? As opposed to healthcare, where this idea of a little bit more holistic, where you do prevention as probably a huge part of the, the entire practice. So that's actually interesting that Tommy Douglas really thought about prevention was a key component of his comprehensive approach. Did he have I don't know if any of his writings or any of his later on in his life where he spoke more about that concept of what did he mean by prevention? Did he mean sort of incentivizing people to, eat better, get better sleep, build better education system? Like, what was his thought process? At least, what was his ideal comprehensive healthcare system?
Well, it started with the sort of a comprehensive primary care clinic that would have nutritionists and others involved that would help people with that. But it extended beyond that to community groups that were prepared to offer exercise programs and other things that would, in a sense, address, you know, uh, heart disease, diabetes, etc. And he would have, I mean, he would have argued that this needed to be organized. And in fact, Saskatchewan had a system of health regions, which he invested heavily in as through his government, in order to knit that together as a system. It was the first set of health regions in the country. By the 1960s, it had largely dissolved. And then it was recreated again in the 1990s in Canada. In Ontario, it took until the 2000s. But the point here is that it's not just a matter that you have the sort of the right organizations, but you need to knit this together into a system, a coherent system. But the primary care providers are critical because they, in a sense, need to be the people that patients go back to all the time. That the emergency department should not be the main locus of your either illness care or wellness, for sure.